What's up, everybody? Welcome to the show. Today we had a wonderful conversation with Maliha Khan. She is a therapist based out of Houston. Let me pull up her information real quick and then reading it off. Okay, here we go. So this is a great conversation. It's something that I wanted to do for a while. It was about Muslim mental health, fasting, Ramadan, all that stuff. So a little introduction about Maliha. Maliha Khan is a licensed therapist from Houston, Texas. She has private practice and also works at the Menninger Clinic, where she completed her training. She has led clinical research studies at MD Anderson Cancer Center and Rice University in the field of psychoneuroimmunology, which focus on how relationship and psychosocial stressors impact immune function. As a therapist, she specializes in anxiety, depression, personality disorders, and trauma. She's Pakistani American and is passionate about spreading awareness about mental health in the South Asian and Muslim communities. She has been featured in Psychology Today, Real Simple Magazine, and Brown Girl Magazine, as well as news channels and radio shows. She has authored mindfulness meditations for the Sabr app, which is the first meditation app for Muslims. She has also worked with various Muslim organizations, including Dar es-Sakina and An-Nisa. She continues to promote mental health awareness on her social media platforms such as Instagram, YouTube, and TikTok. Her purpose is to create a safe space for Desis and Muslims to unlearn disruptive patterns and create healthier ways of living, so they can build more fulfilling lives for themselves, their families, and future generations. So buckle up. We had a great conversation. We're going to learn a lot. So, and just kind of a disclaimer we put in there. Again, neither of us are Islamic scholars, so we're trying to do this to the best of our abilities. And if there's anything that we said wrong, please forgive us. Thank you. All right, everybody, welcome to the show. We have a great episode, great conversation, great guest on queue for today. This is somebody and a topic I think that I've been wanting to talk about for a while. And right now we're in the middle of Ramadan. We're hoping to have this a little bit beforehand, but stuff comes up. So we're trying to get it out sooner rather than later. But this is Maliha Khan. I'll let her introduce herself and then we'll kind of jump on into the conversation.
Assalamu alaikum. So glad to be here. I'm excited to talk about this topic. A little bit about myself. I'm a therapist in Houston, Texas, and I started my training at the Menninger Clinic. That's currently where I work, but I also have a private practice. I'm really passionate about spreading awareness regarding mental health when it comes to the Muslim community and South Asian community, because I feel like there's a quite lack of information out there, and there's a lot of misinformation out there actually. So my goal for my work is to really break that apart and help people have appropriate knowledge from a reputable source, so that they can learn healthy ways to function, not only for themselves but their families.
Yeah, so I came across your page like on Instagram, and I was like, I want to talk about Ramadan and mental health concerns for Muslims as we get into it, because I'm sure you do as well. You get a lot of questions from people who are Muslims and maybe non-Muslims, right? A lot of non-Muslims. There's a lot of curiosity about like, what's Ramadan and how do we deal with it? And are these things okay? And, I'm sure growing up, like I kind of did like this thing a couple of years ago with a lot of like the memes about like the stupid Ramadan questions, right? Or the common kind of questions that you get. So I was like, let's kind of jump into that. Let's start with there. Like, what is Ramadan as a whole? Like, is it just not eating and not drinking, and like, can you have water? And what are some common kind of misconceptions that are out there?
It's funny that you bring that up about the questions, because literally the other day someone said, not even water. Yeah. That's one of the most famous ones. Not even water.
Not even water. Yep.
Wait, sun up to sundown, and there's quite a few within the non-Muslim community, but also I think even within the Muslim community we might focus so heavily on the food and drink part, when Ramadan is so much more than that. Ramadan is about being able to fight with our nafs, being able to manage what our nafs comes up with. And our nafs is that very human part of us that calls us towards things that might be harmful for us or things that might be sinful. So things like lying, backbiting, yelling at people, swearing, those are all things that we're generally discouraged from in our faith, but especially in Ramadan, that's something that we are encouraged to be mindful of. And then Ramadan is also about adding good deeds. So giving in charity, doing more zikr, going to Tarawih, being kind to other people, volunteering, and also reading the Quran, because Ramadan is the month of the Quran. It's the month when the Quran was revealed. And, being introspective, being reflective on the Quran and ourselves is something we're very much encouraged to do. But we tend to, even as Muslims, we tend to just focus on the food and drink part heavily. And I think it's because that's such a big shift. That's kind of the biggest shift that happens in our daily life when it comes to Ramadan, that we're giving up food and drink. So naturally, people focus on that part and make the other parts of Ramadan kind of minimized in a way.
Yeah, and I think it's the part where it's like everybody can see that, right? They're like, oh, Salman's not going out for lunch anymore. He's not, he's not running to the water fountain all the time. Like, that's the stuff that people can see. And the other stuff is the harder to see stuff, right? It's the internal kind of struggle, internal kind of changes, the things that we do. So.
Totally. And there's, even the community piece. We are usually spending iftars with our family. We're having sitting down together, having a meal together. So again, even, within our homes, there's such a heavy emphasis on that. Oh, what are we going to have for iftar? Or what are we going to eat for suhoor? So I think those things reinforce that concept quite a lot.
Yeah. So yeah, and I think that's like for people who are on the outside, it's like there is that aspect where, right, we're not eating, drinking, but we're really trying to make those big changes, right? Those internal changes so that we can be better human beings and better all that stuff. So awesome. I was going to say also, like, before we kind of like get deeper into this, like, I'm not by any means like a religious scholar or expert. I'm not an authority on anything. So we're trying to speak from the best that we're our own kind of research and stuff. So if we say anything, please, check with your imams and everybody else, and God knows best kind of thing, right?
Totally. Yeah, I think that's it's important to say that and start off with that, because yes, neither of us are scholars, Islamic scholars, right? And I know the intention really here is not to offend anybody or to be harmful in any way. It really is to provide information that could be helpful for people, and we always recommend to speak to your own treatment team, your own therapist, your own psychiatrist, and your own imam to get clarity on what you're going through personally.
Yeah. So one of the reasons we wanted to bring you on here is because there's a lot of when Ramadan comes, there's a lot of feelings that come from people within the community, right? You talk with like my wife, friends, our community, all people, and people are like, oh, I'm so excited for Ramadan. I can't wait for it to come. Like, this is like what I look forward to every year. We commonly hear, like, if you go to the mosque, that like, the imams will say things like, oh, the last couple of days I start crying because I'm going to miss Ramadan so much. And like, I hear some of this stuff and I'm just like, what is going on, right? You're like, is this how everybody is? And then, sometimes, I have patients who are Muslim and they'll be like, I dread it. I don't look forward to it every day. Like, I mean, when it's coming up, and there's so many kind of this wide gamut of feelings. So in your thought, like in your experience, like, why do you think there are some people who feel they can't wait for it to come, and other people have the opposite, like, I don't want it to come?
Right. I think we have to start off with talking about, this idea of, like what you said, there are some people that experience the anxiety, nervousness about Ramadan coming, and then there are people who feel so excited. So we have to talk about the emotion of nervousness or anxiety. That is a very natural emotion that has existed since the beginning of time. Even in Islamic history, we look at the stories of the prophets. We know that they went through some really intense challenges and tests that were very overwhelming for them. And they were human beings, and they experienced human emotion, like feeling overwhelmed, feeling fearful, feeling anxious. They experience all of that. Even if we think back to the story of Prophet Muhammad, when he first received the revelation and he meets Jibreel alayhi salam, as he's talking about this experience, he's very overwhelmed when it happens. He's talking about how he was fearful that he was going to die as Jibreel alayhi salam is squeezing him, telling him to read. And we know that when he went to his wife, he was shaking because it was so intense, it was so overwhelming for him. So I think, if we just think back to that and we ask ourselves, hold on a second, how how do you think he was feeling in that moment? I imagine that people could say that he may have felt fear, he may have felt anxiety in that time. And he's one of the best of the creations, right? So the reason I bring this up is to say that anxiety is a natural emotion, and even the best of creation experiences anxiety. So we are not exempt from that. We will probably feel that way too. And yeah, there's many reasons people might feel anxious in Ramadan. Like as a student, let's say a student has intense exams coming up, right? They're going to feel anxious about, okay, how is this going to work out with Ramadan? If I'm fasting, how am I going to have energy to be able to get through my exam? I'm sure if you think back to your time in med school, there were certain things that you may have had to adjust when Ramadan was coming up, or even through residency, right? Or even being a parent to a young child. I am. I definitely had some level of anxiety when Ramadan was coming, because I was thinking about how I'm going to manage having a young baby and, fasting. This was my first Ramadan after becoming a mom, where I was going
nice.
to be
Congrats.
fasting. Thank you. But yeah, it's my first Ramadan where I was going to be fasting in Ramadan, and it was nerve-wracking for me in a lot of ways, and I had to do a lot of talking with myself of, okay, this is my plan for Ramadan. This is how I'm going to manage, having a young child, because kids, they take a lot from you. Young children, they require a lot of your attention and a lot of your energy, and their energy tank is like up here all day long, right? And they're not eating, and you're frustrated. You're like, gosh, please just eat this food. I'll eat it if you don't want to, but I can't eat it right now. And it can be frustrating to experience that. But yeah, those are just some reasons why someone may experience Ramadan anxiety.
Yeah. And, I get a lot of questions about like, oh my God, can like I take medications and all this stuff, and, like, am I exempt from it? But, and I think that's one of the common, excuse me, one of like the most common misconceptions, I think, like with Islam is, and any kind of religion in general too, is the niyat, what we say, like the intention of things, right? So in Islam, like niyat, this intention is like of the utmost importance. It's given so much kind of like talk, versus like the rigidity in absolutism that, sometimes the media more portray, or some more, the intention is the biggest part. So talk about that a little bit, some of the aspects of like niyat and with Ramadan too.
Mm-hmm. Totally. Yeah, there's hadiths where the Prophet Muhammad also said our actions are according to our intentions, and everyone will get what they intended, basically. So, if our intention was to do something for a worldly reason, we will be rewarded according to that, compared to if we intended to do it for, the sake of seeking closeness to Allah. And I think many of us set out to do Ramadan in a very specific, like you said, a very specific way. It might be very rigid. We might have this perfect plan of how we're going to, seek closeness to Allah, to make Ramadan worthwhile for us, so that we have something to show for ourselves on the Day of Judgment. So let's say someone plans to wake up for suhoor, and between suhoor and work, they're going to finish a juz, and then at lunchtime, they're going to do like 5 rounds of tasbih, and then between, work and iftar, they're going to read another juz, and then after iftar, they're going to go for tarawih, right? A few days of doing this, after a few days, we're probably going to be burnt out. And that definitely happens to people. So while, yes, we set out with the intention to make the most of our Ramadan, because we approached it from this very rigid or unsustainable way, it led to our fuel tank being low. And then maybe at that point, we don't even have energy to keep up with our obligatory prayers, right? So now, not only did we not meet the goal or plan that we have for ourselves, we didn't, we're not even able to keep up with the things that we're supposed to be doing. And when we practice that, it can lead us to feel even worse about ourselves, right? We might start thinking, well, this Ramadan was not even worthwhile for me. I'm good for nothing. Allah probably wouldn't even accept this. So what's the point of trying? And now we've given up, and we're stuck in this place.
Yeah, and I think it's that aspect where, like a lot of religions and a lot of kind of faiths have the guilt, right? The religious guilt, the whole concept of like Catholic guilt, this common term that we hear, where it's not really, right. And if we, true believers of any kind of faith, again, is this idea that the higher power is a forgiving God, a forgiving being, and that your intention, where your heart is where it's at. So it's kind of this idea of like, I'm intending to, again, complete the prayers, complete the fast, and if it doesn't happen, God understands, right? And it's this, but it's kind of in the same vein of like, if we're trying to like do ill, but we do good by accident, or the outcome is, again, like we'll get some good benefits, but also there's like the aspect of like, it wasn't with the best intentions of where this kind of came from. So
Right, and it's like what you said. This absolutism usually comes from a place of seeing Allah as this, angry God, right? Like, I'm doing this to avoid his anger or avoid his wrath. I'm doing this to avoid going to hell. Whereas if we have a healthy perspective, we see Allah as a merciful God, and that generally helps us feel closer to Him. You brought up the idea of guilt, and it reminds me of something that Brene Brown talks about. Brene Brown is this famous researcher. She talks about shame and perfectionism and being rigid and having these like strict rules for ourselves and living life from that way. She talks a lot about how, what shame does to us and what perfectionism does to us. So yes, guilt is a very helpful emotion. Yes, we all feel guilty, and it is necessary to feel that way in certain times, right? Because guilt helps us do things to make a positive change in our lives. But guilt is about what we did. So it's attached to an action or behavior. Shame, on the other hand, is about who we are, right? So guilt is I did something bad, and shame is I am bad myself. Right? Guilt holds us accountable. It gives us the space to grow and create positive change in our life. Shame, on the other hand, it makes us feel like, well, what's the point of trying? I'm good for nothing, right? So it corrodes that very part of us that gives us the motivation to create healthy change. So yeah, I think it's important to steer clear of that way of operating, that perfectionist or rigid way of operating.
It's a common kind of like concept, right, that we see, in the mental health field, the concept of like, trying to avoid this black and white thinking and trying to have embraced kind of the world is gray and that there's nuance in the world, and a similar kind of application to faith, religion, and lifestyles, right, beliefs. So what are, we kind of joked about like the not even water questions that we get, but what are some reasons, some exemptions about or contraindications for fasting? What are some reasons that people are allowed to not fast?
I think we know of the common ones. Like if you're traveling, you are exempt from fasting, or someone who might be pregnant, a woman who's pregnant, or a woman who's nursing, they're exempt from fasting. When it comes to illness, yes, most people know that if you're ill, you are exempted from fasting, but there's more to it. So there is, yes, someone who's ill, and then there is someone who fears that their illness is going to get worse if they fast. They're also exempt from fasting. Then the third one is someone who fears that their recovery is going to be delayed. If they fast, they're also exempt from fasting. And then the fourth one is someone who believes that fasting will cause serious illness or death. They are discouraged from fasting, right? So there are exemptions in our faith when it comes to fasting. And most of us think about illness as a physical illness, but that includes mental illness as well. And many people don't know that.
Yeah. And it's one of the most common questions that I get when I have my Muslim patients is like, well, especially things like eating disorders, and we'll jump into eating disorders, I think, a little bit later, but that's one of the most common ones that we see. With depression stuff, we see things that happen in, bipolar disorder, schizophrenia, like we know that there's so much that's tied to sleep, right? And the sleep-wake cycles. And we know the one thing I think that people who are able-minded, who are able-bodied, who are able to fast and go through Ramadan fasting, like the one kind of common complaint that they'll say is like, oh, my sleep schedule is destroyed, right? Because we're waking up before sunset to have a meal, and then we're just trying to stay awake and do our things during the day, and then we try to break our fast at sunset, and then we have extra prayers that are there in the evening time a little bit later. So naturally, and you know, of course, this it moves through the year. It goes back 11 days per year. It's based on the lunar calendar versus the solar calendar. So during the summertime, right? You know, few years ago it was more during the summertime. We're kind of getting into that springtime now, which is a lot easier than when it's in the middle of July and August. Those days are 14 something hours, right? Versus, and then wintertime it's 8 hour fast. So people whose like depression gets really bad when sleep gets thrown off. Bipolar disorder can get absolutely triggered, and we can have a manic episode triggered by these things. Like, you know, are we going to tell these people like, hey, you have to abide by them? No, right? That's not part of the deal.
Right, and unfortunately, the most Muslims don't have that information, and their family members might tell them, no, this is something you have to do, and they're struggling. You know, I was researching, and I was on Reddit, because I think that's a great place to hear what someone might think or say, because they're able to say it anonymously and openly. And I came across a lot of different posts from Muslims talking about how they're struggling with mental illness, and you know, some of them have been discouraged from taking medication in Ramadan or outside of it, because they're like being told that you need to just be able to do this yourself if your mind is not strong enough, or you know, a multitude of reasons that are not helpful, and that it leads a person to feeling so much worse, honestly. And I think we have to be careful about that.
Yeah, we have like the whole idea of pill shaming within the community first and foremost, but then it like becomes this extra kind of burden almost, it seems like during Ramadan, because like you'll hear all people being, well, if you just pray and if you just fast, then this will take care of that, right? Like, and
Right.
is that true or not true?
Right. And you know, you're saying this. Someone commented on one of my posts when I was talking about fasting and you know, having exemption from fasting, and the person was like, "Wait a second! Oh, I've always heard that with the zikr of Allah, that's how hearts find peace, right? And that fasting is supposed to be helpful for mental health. And yes, it can be helpful for a lot of people, and then in some cases, it impacts us negatively. And there is, you know, that's literally why there are these exemptions, right? That Allah knows, He understands the human like behavior and our psyche. He knows that we're going to be challenged in ways, and He says He does not intend hardship on us. He intends ease for us, right? But people, it seems like sometimes they don't focus on that part. They kind of take, you know, the commandment for fasting over everything else. And I did want to mention here a piece that I came across about, you know, Allah says that He loves His concessions to be accepted, just as He hates for acts of disobedience to be committed. And I think knowing that is very powerful, because Allah talks about the seriousness and validity of having these exemptions, and He places them for a reason. But unfortunately, people don't give people that same exemption.
Yeah. Where do you think this kind of comes from, this aspect of people not creating the space for this, or trying to like eliminate almost these exceptions? Where is that coming from?
I think there's so many different areas that can grow out from or grow from. One is lack of awareness. You know, what is mental health really? When we talk about the word mental health, everybody has mental health, but not everybody has mental illness. But you know, even that itself is like, the concept of mental health is, you know, is this jinn possession? Does this mean you're a bad Muslim? You know, if I go to social gatherings, you know, people will ask me, what do you do for a living? And I tell them I'm a mental health therapist. And some people will say, oh, that's great, we need more of that in our community. And then other people say, hold on, you know, wait, you're a therapist? Do you see white people? Well, you probably see white people. Or, oh, you probably see crazy people. And I tell them, no, I see people like me and you. Because oftentimes that's literally who I see. It's anybody, you know, it could be anybody. But there's this idea of, you know, that it has to be someone who might be have severe, intense disability or intellectual disabilities. That's the kind of person that might be coming to therapy, or that's what mental illness is, and it's so much more than that. Another reason could be, you know, in a family, if someone has experienced personal trauma of losing someone to suicide, let's say, and they've kept that silent. They've kept themselves from being able to engage in a healing journey. When we create that silence, it doesn't allow space for us to learn how to manage that, what we can do to help somebody else who's in that situation. So I guess, for example, let's say there's a guy named Akbar, right? Akbar's uncle passed away from suicide before Akbar was even born. And Akbar grows up and he experiences suicidal ideation himself. He has thoughts of suicide or not wanting to be around. And he's confused. His family, if they've kept things silent, chances are they never got the proper resources or didn't know how to help him. So now Akbar is in pain. Maybe he opens up to his family about it. Oftentimes people don't even say that out loud, right? But let's say he opens up to his family about it. His family has no idea how to help him. Right? And the cycle continues, the dysfunction continues, and it prevents people from being able to go on a recovery journey and get help.
Yeah, and I think it's important because there is so much of this, how do we say, like, this idea of like family pride and family kind of like, the honor of the family that's there, where it's like, oh my God, these things happen, so let's be quiet about it and hush it up as much as possible. Like, I know there are plenty of people who have like, our friends and stuff who have siblings or family members or cousins, whoever and whatever it is, who have like, again, like developmental disabilities or other stuff, and it's like, oh, I never even knew this until you like directly asked me a question about it, and I was like, oh, I've known you for 10 years and I didn't know that you have like a brother with something or other. And it's like, where is this kind of coming from? And it is this aspect where like there's almost this element of shame that comes, again, like we were talking about before, of like, I can't even talk about this person who's my brother because they have autism or something else like that.
Yeah, you're so right. My brother has autism, so I resonate with that. Earlier on when he was diagnosed, there was a lot of confusion or shame of how to kind of deal with this in the family. And it took a lot of education to come to a place of, this is something that happens to people and it is a challenge, and how can we be supportive of our loved one, right? Thankfully, there are more communities now. There's some work around that. That's creating healthy, open dialogue and allowing families to have resources. And I think that's making a huge difference in people being able to address it in a healthy way and remove that shame.
Yeah. Which I think is like, we can't hide these things anymore because I think it's just not possible. So good. I'm glad to hear that there's support, and again, like we have friends who have like kiddos with autism, really, really severe autism. And it's just like, it's really good to see when the community comes together and is like, we're not going to put this kid and ship them away, right? Like we may have done generations ago, and maybe not even generations ago, like currently happening, I'm sure. But like stuff that you were like, hey, we're going to embrace this kiddo and we're going to help him out and be there and support mom and dad and all that stuff. So I'm glad to see that there's movement with that, at least. So with this kind of aspect of it, so we have this kind of other kind of unique, almost unique, I want to say, South Asian and then like Muslim kind of concept of like Ghiba, which is, gossip and backbiting. And it's, in Islam, it's considered one of the highest sins. I think it's like the second highest sin that's out there, besides like from shirk, besides like saying another person is God, essentially. It's an idea of how important this is, right? Not talking about each other, not backbiting. We have this like with fasting, right? When people don't fast for whatever reason, it's almost that gossip. The questions like, why isn't so-and-so fasting? What's going on with them? Is something all right with them? Or like, have they gone away from the religion? Are they out? Like all these things that come about that. So let's talk about that a little bit, that whole concept of that.
Right. I think there's a lot of fear in the community about judgment, from other people if we open up about our mental health. People might think, it's because I'm not praying enough, or maybe because Allah's punishing me because I'm such a messed up person, or what if this becomes the reason that I don't get married, right? Or what if people think that I'm possessed by a jinn? And I would have liked to think that one isn't as common anymore, but unfortunately, that misconceptions is very much alive, and that is something that people still believe in. And I think that fear of what other people might think, it creates this, more silence and more shame. And you said, people engage in Ghiba, and I think a lot of us think about Ghiba as spreading false information about people. But Ghiba is anything that you might say about someone that if they heard it, they would not like that, right? It would upset them to hear something like that. So it could literally be anything about them. It could be the truth, but that is also included in Ghiba, right? And I think we take it so lightly, like we're just storytelling. Oh, I'm just talking. I'm just sharing something funny, like a funny thing that happened, or, oh, I was worried about them, and so I said it, right? But if that person is not ready to have that shared, if they don't want that to happen, then it is not our place to speak about that, right? That's someone else's journey, and I think we have to be respectful of that. And like you said, it is one of the major sins in Islam, and something we're definitely going to be asked about in the next life. But in this life, like I said, it creates a lot of fear in people. So if you leave a gathering where Ghiba was taking place, you're going to be careful and cautious. You're going to worry that, okay, these people are talking about this, maybe they're my friends, but now I'm worried that they're going to say something that I've shared with them in confidence with other people, right? So that ultimately then leads to people not seeking help, because if this conversation is happening about someone's mental health or what that means, and there's input or misinformation out there too, and that can lead people to feeling like this is not a valid enough reason for me to have a mental illness or to not fast, right? And that's very problematic.
Yeah, and I think it was really important what you're saying about not seeking help, right? Because, I've had people unprompted, of course, I'm sure you have as well, like tell you stuff, and you're like, "Oh, this, we're just trying to hang out. I'm not trying to like, we're just
Yes.
trying to." I always joke around like I was sitting around with a buddy and we're trying to watch football, and then all of a sudden he starts telling me about like, childhood abuse that was going on, and I was like, "Whoa, I'm just trying to watch the game with you, right?"
Yeah, totally. Yes.
But that aspect of like, people, people talk, right? People always are going to say something, and you want to be careful about being scared of, if you betray that trust or anybody else betrays that trust and starts running their mouth about stuff, and then why would they want to trust anybody else? Why would they want to kind of go and seek professional help if this is what their experience has been, is they've told somebody and then that person's told somebody else about it? So it causes a lot of issues. And again, it kind of comes back to that, the whole idea of mental health in the community of like, this is this tabooish kind of topic, and you should be quote unquote praying harder to get rid of this stuff. And then I was like, oh my God, Sulman is seeing a psychiatrist, and how terrible, what bad stuff it must be up to if he has to go and see a psychiatrist or a therapist and stuff like that. So
Yeah, totally.
it's trouble.
It is very much so. And, as we were talking about, this even reminds me of people saying things like, oh, that's so ADD, or, oh, I'm so OCD when I do this, or, oh, that person was, they were upset, oh, they're so bipolar. And I think we have to be careful, when we use these kind of terms to describe average, common things happening. Because one, it is a stigmatized way to explain someone's behavior when we're using it in that context. And then two, it reinforces like the misconception of what these illnesses are, and then it minimizes the intensity of what someone else might be experiencing. And if someone experiences that and they hear it, of course it's problematic. Prior to Ramadan, I was at a coffee shop with one of my friends who does have ADHD, and on the table next to us, there was a conversation happening, and one of the ladies on the table said, "Oh, ADD much?" And both me and my friend, we look at each other and we're like, "Oh gosh, no," But it's so common. It's so common, and it really, it's a disservice to people.
It's kind of that double-edged sword of like the mental health awareness. I always kind of say is like we did such a good job of bringing mental health awareness and bringing it out there that now again these diagnoses, these serious diagnoses, have become just part of our normal everyday language, and they've lost meaning almost in a way, and then it kind of gets weaponized against us. Or in the notes we had written something about spiritual bypassing in Ramadan and outside Ramadan. Talk about that a little bit. What does that mean?
Yeah, I think that is quite common, and I think it's related to some of the things that you said earlier, that people might tell us, don't be depressed, just pray, or you have so much to be grateful for. Why are you having thoughts of suicide? And we can tell ourselves these things, and other people can tell us this stuff too. And usually it comes from us hearing these things from other people, that I shouldn't be feeling this way. I shouldn't be thinking about all the children in the world that don't have what I have. And I think that over time, that can be quite harmful for us. And when people say that to us, they might, be coming from a well-intentioned place, but doing that is very problematic. Telling someone that prayer is going to resolve their anxiety or depression, and it not working out for them, it not only creates more anxiety and more frustration for them, but it also can lead to people feeling disconnected from their faith. And I've seen that happen in my clients, or just people in the community. We're attaching someone's mental health to their acts of worship or their connection to Allah. And if someone is not receiving the same level of resolution that they were seeking through that, it can reinforce that idea of maybe there's something wrong with me, maybe I'm a bad person, maybe God is forsaking me, and so now even though I'm trying to get close to Him, it's not working. Or people can get angry or upset with God. Why is He doing this to me? I'm trying. I tried this. I was told this is the solution, and I've tried it and it doesn't work. So why is God doing this? Or does He not care about me? And if He doesn't, okay, then I don't want it. And that happens. Unfortunately, that happens to quite a lot of people.
Yeah. Going to the topic of mental health in Islam a bit more too, and how we approach it. Is seeking mental health treatment in Islam a thing that's there or not? Should we just be praying more and fasting more?
There's a hadith where the Prophet Muhammad says, Allah has sent down both the illness and the treatment, and He has appointed a treatment for every disease. So treat yourselves medically, but use nothing unlawful. So I think that itself speaks volumes. He literally tells us to go out and seek treatment for what we're going through. Yes, physical illnesses, but also mental illnesses, right? And Islam does promote lots of things that are protective for our mental health, like refraining from substance use, or gambling, or being sexually promiscuous, or treating others poorly, being kind to other people in our relationships. Those are all things that are protective. And then in the Quran, over and over again, Allah reminds us to be introspective and reflective, and do internal work and think about things in a different way. So this is Allah telling us, He doesn't just tell us things for no reason, right? He wants us to know how to address our minds, and I think we have to take that into consideration for sure.
Yeah, and I think there was, I can't remember the exact term. Maybe you can help me with it if it comes to you. But one of the things that I like about the religion, right, is that the religion was started 1500 years ago, and now we're in the 21st century, right? So there was this idea of we always have to keep up with the times and what's available to us, right? There are people who are on the extreme ends will say things like, well, Prozac wasn't there 1500 years ago, so it's not allowed in Islam. It's no, you're making a little bit of a leap there to kind of say these things. It's if cars were allowed, or if cars were around back then, would they have been walking around or using camels and stuff to get around? No, of course not. We're allowed to progress with the times, right? And we're allowed to kind of keep up with the treatment options and healthcare that are available to us, right? Again, modern surgery wasn't a thing that was there. It's that we're going to prevent us from getting these treatments because this wasn't there, and 1500 years ago, of course not.
Right, totally. You're right about that. There is a lot of misinformation about this, and one resource I definitely wanted to mention here was Dr. Rania Awad from Stanford University and the Khalil Center and the Keene Institute. They're doing a lot of great work when it comes to spreading information about mental health in Islam. Treatment for this has existed for a very long time, and they do they bring in licensed professionals to talk about that, about Islamic history and how mental health treatment was a big part of that. And it's existed for a long time, but we've lost track of that. And I think if we go back to that and we see, okay, hold on a second. There was a concept of treating people with antidepressants even at that time. I wouldn't know what chemicals or substances they use, medication they use for that. But I would definitely encourage people to check those resources out to learn more.
Yeah. And then, like, even just in general, part of mental health, spirituality and faith, they're a part of it, correct? Like, that's something that we talk about and discuss, right?
Right, totally. That's something we definitely talk about in therapy. I do believe that spirituality and faith are part of our mental health, and they're impactful in our mental health in a monumental way. Are they all of it? Are they the only solution? No, but they're definitely a part of it. So we don't want to ignore that. Our spirituality, our connection to Allah can be incredibly impactful and positive when we come from a holistic perspective, and keep that into account as we're getting treatment.
Yeah. We talked about a little bit before about like how some of like the sleep stuff can throw off, especially coming back to Ramadan, sleep can get thrown off and how that can have an impact on mental health and, depression, bipolar, all that stuff. Let's talk about a little bit more about like eating disorders, because that's, I think, one of the ones that gets a lot of the attention a little bit more during Ramadan, because there are people who will be like, well, fasting, like, isn't that making eating disorders worse? Isn't that like making, because so much of the gross outside kind of attention comes to the eating and the drinking aspect of things. So let's talk about that a little bit. Like, how do we deal with that and with that as a whole?
Right, you're right. Just like you said, sleep and wake cycles impact bipolar disorder, or depression. Eating patterns in Ramadan can definitely have an impact in people who have eating disorders. So, some of the practices, of course, we're refraining from eating for a very long time. And when we do eat, a lot of us might binge eat at iftar or suhoor to make up for the loss of having nutrients throughout the day. And those things can reinforce some of the disordered eating patterns that we see in people. So it definitely is a reality, and I think something that can easily go unchecked. And a lot of times people might not even realize that they're doing it for that reason, right? Or loved ones might not be able to catch it because Ramadan is almost like a perfect opportunity for someone who has an eating disorder. And people who have eating disorders definitely talk about that they might, look forward to Ramadan in a way that, I'm going to get to practice these things that are important to me and reinforce my eating disorder. And because everybody else is doing it, it goes unchecked.
Yeah, it's a way to kind of hide right out there in the open in a way. I know it's like, and it's one of the things with eating disorders that makes it really hard to kind of treat, I think, too, from like a provider point of view, is that it becomes so much of somebody's identity, right? And they have so much comfort that comes from the eating disorder almost. And again, I'm just generalizing a little bit, but it's so hard to kind of give up. It's really, that aspect of, I have patients where we help the depression and then the eating gets better. Then it's like, no, I don't want it to get better. I don't want to lose this aspect. This is the only thing that's brought me some comfort to an extent. So it's this push and pull that comes, and kind of like we're saying, we're hiding out in the open of being able to have that there, which makes it harder for sure.
Right. And it's like what you said, eating disorders and other mental illnesses can definitely become a part of our identity and something we hold on to. Although, yes, we can identify that these things are impacting us in a negative way, but sometimes because has been our norm for such a long time, it's scary to do something different. It's scary to see the possibility of something else, right? We, in some ways, sometimes can be very protective of our illness and hold on to those same patterns.
Yeah. What are some ways that people can get some help, I guess? How can they prepare for it, or when this is kind of coming up, so we know that when Ramadan is on the calendar, and how do we deal with that?
Right. I think one of the things that we can try to do is try to seek support. Try to see if there's someone within your community, within your group of loved ones, friends, family, who can be supportive of you. Someone that you are able to trust, right? That you have faith in them, that they're going to give you sound advice. Let's say you don't have anybody like that in your life right now. See if you're able to cultivate a support group outside of that. I know that right now there are a lot of virtual groups going on for Muslims, especially when it comes to Ramadan and their mental health. So the Jackson Wellness Group in Maryland, they're running a virtual group for people who might need mental health support in Ramadan. And then Amali, I hope I'm pronouncing that correctly. That's another great organization that is hosting virtual groups for people who are experiencing substance use disorders or eating disorders, and especially in Ramadan, they're hosting this group. And then, we have the National Alliance Mental Illness, NAMI. You can go on their website and filter by your location and find a group in your community and see if that's something that you can join to seek support. So that's the community support, having someone to be able to support you. But let's say you're noticing that your mental health struggles are impacting you personally, like they're impacting your ability to function in your social life, at work, academically, spiritually. If you notice any of that, those are definitely signs that you need to seek out, treatment from a professional. So try to do that. And I know that, and I imagine that you resonate with this too. A lot of people come to us in crisis. It's like after the fact, when something terrible has happened. That's when they come to us. That's when they seek professional support. But we know that when you catch it earlier on, it makes a monumental difference in someone's recovery.
Yeah, preparation is always easier and more effective than kind of recovery or trying to clean things up afterwards. So
right, yeah, being proactive is more helpful than being reactive.
How can we, we're both Muslim mental health professionals, like what can we do, or what can, the communities do as a whole to kind of have that discussion a little bit more, to kind of break down the stigma so that we're not just, hiding behind closed doors, and that we're really busting down the doors and having these conversations out in public and in general.
Right. I think what we're doing right now is really great, though. Doing more of these podcasts. I think this is a great place to be, but also, within our communities, I know most Muslims, they want to seek advice about how to live life from an imam or through the masjid, right? That's something Muslims very much value, that they would rather seek mental health support from the imam or someone at the masjid, a faith leader, right? So I think being able to host community events at different masajid or community centers where we bring in imams and also licensed professionals to talk about mental health in a healthy way, because then we're able to get information from reputable sources, information that is accurate. It's not, coming from, the stigmatized place. It's talking about mental health in a compassionate way. And when we do that, naturally those conversations start trickling down into our homes, and then we're talking about things, in a healthy manner. And when we do that in our houses, then it makes a huge difference for the community in general.
Yeah, because I know that, not talking about something doesn't make it not happen, right? It's one of those things that, people will seek something out, and they're going to find out, they're going to go on, of course, what's available to them, what's social media and Reddits. And again, like there's absolutely parts of those communities which are helpful. But I think, I always quote this kind of paper that came out with saying that like 90% of the mental health information that was on like something like TikTok is false, right? It's wrong, it's misinformation. And would you rather be getting your information from TikTok, or would you rather be getting it from people who do this for a living and know what they're talking about?
Right, totally. You're so right about that. It reminds me of when I was younger, and I first heard about jinn. I was so scared. It's like, gosh, I better never have an encounter with a jinn. What am I going to do if that happens? But when I started learning about jinn through khutbahs and from reputable sources, the fear started going away, right? The misconceptions started disappearing. I knew what I needed to do if I were in that situation, or what to do to prevent myself from ever being in that situation. So it's like what you said. It's not, if you don't talk about it, it's not like it doesn't exist. It still exists. It's about how you have a healthy conversation surrounding it. And when you do have a healthy conversation, it's empowering for people. It helps them see that they have options, that there are ways to seek positive help and support.
Yeah. How can families and communities kind of like, what can they do to come together to like support somebody's mental health? So if we know that like somebody's dealing with whatever, what can we do to help them out instead of just kind of pushing them away and in the corner?
Totally. Yeah. all have clients that have support from their families and the people who don't have support, and we can see the difference it makes, one compared to the other in the person's recovery process. So as a family member or friend, one of the first things that we can do is get educated, know the risk factors that could put your loved one's mental health at risk in Ramadan or in general, and then know their warning signs, because everybody's different. Know the warning signs of their mental health declining. You might ask them, tell me how you would be able to tell that things are not working out for you, or that you need extra support, or noticing behaviors like, are they not texting me back? Are they more quiet when they're hanging out with me? Are they spending a lot of time sleeping? When people are experiencing depression, they are very fatigued. Even if they sleep at night, they don't feel rested. They spend lots and lots of time taking naps. So if that's happening, that's something to know. And then the second one is to know how to support them, know what to say and what not to say. Refrain from saying things like you're being dramatic, or you need to just pray and everything's going to be okay, or think about the kids and, wherever, and you have so much more than that. Try to say things like, I'm here for you, or how can I support you? What can I do? Or if you're not ready to talk, it's okay. Let's just hang out, and when you're ready to talk, I'm here. There's a difference between the two, right? One is compassionate and allows space for the person to be able to say, like, okay, I have the support, right? And then the other one is saying, no, you're not allowed to feel this way. What you're feeling is wrong, right? And we can be there through our actions. Like I said, people who are experiencing depression, they might not have the energy to do things. So offer to do their groceries or clean up or drive them to their appointments, things like that.
Yeah, I think, again, it's really important when we say things like, hey, I'm here for you, right? And it may seem like a nothing from the person who's saying that. It may not seem like it's much, but it means a lot from the person who's receiving that, to kind of hear that, like, they're not alone, because so much of mental illness and so much of these disorders is the idea of, depression, anxiety lie to us and say, like, you're alone. You're the only one who's dealing with this thing, and nobody cares about you, and et cetera, et cetera, et cetera. But when you hear that from somebody else saying, like, hey, you want to just sit down together? You want to just hang out? You want to, like, grab something to drink or eat, whatever? Makes a huge difference.
Oh yeah, for sure. For sure it does.
Then, so that's families and, like, community, but what about, like, faith leaders? I know we touched on it a little bit before, but, like, what can area moms and Molvies and everybody else that's out there, what can they do to help support the communities and beyond?
Yeah, I think we, as I said earlier, we need to have open discussions, but maybe even going a step further, talking about some of the other mental illnesses that we really don't talk about. We focus on anxiety and depression. What about having bipolar disorder? What about talking about eating disorders at the massages, right? What about talking about personality disorders or toxic family traits? All things that impact people's mental health. Those are things that we don't necessarily hear as much in the masjid, right? But being able to have conversations around that, and yes, being collaborative with therapists or licensed mental health professionals, bringing them in to have a collaborative conversation about this, or even having support groups at the masjid. Oh my gosh, how incredible would that be if we were to do that, right? And I know therapists who are willing to bring in imams if that's what their client needs. They're willing to bring in imams into the therapy session, as long as you sign a release of information form. That's something you could totally do if that's what you need in therapy.
Yeah. Cool. I think we had a couple questions on Twitter that I threw out there before. So Sana Shamim, she's somebody, following for a little bit, going into psychiatry. I'm like, yes, we need more psychiatrists, Muslim psychiatrists. So she had asked a couple questions. One was like, thoughts on approaches to people that say depression and suicidality is a lack of faith. We talked about it a little bit, but something maybe that to expand upon, a little bit more specific.
Yeah, I think, as we said earlier, we have to be careful about what that does to people. It creates lack of safety and being able to, one, open up to that person. Sure, it may be coming from a well-intentioned place, but because you're saying something that that doesn't allow any curiosity in that conversation, right? You're saying, oh, it's definitely this. It's because you have lack of faith. It stigmatizes the person, right? It makes them feel worse about themselves, and they're less likely to reach out to you for help again. They're not going to tell you about it, but they tell the therapist. I definitely get to hear about it, and I've seen this happen for Muslims, but also people of other faiths. I have Christian clients who say that their family members told them to read the Bible, and oh, if you just read the Bible enough, if you just believe in God, or if you just prayed for this to go away, what, right? And then when it doesn't, it leads them to feel further away, or from you, and also from Allah. And I don't know if we want to do that to people.
Yeah, and it's so, again, like invalidating, like we say when we do these things, and or when people say these things, and then again, like it ruins these potential relationships. Again, like with religion, with faith, that can be there. Like, why hasn't God saved me? Because I've done my prayers and I've fasted, and I should be better by now, and like I don't need to take the medicine, but here I am still doing this stuff, and it's again, it brings people away from it. So it's trouble. It's trouble. So it's like it's a part of it, right? I always talk about the biopsychosocial model, and there's a lot of people who are pushing for like another S there, which is spirituality, and that again doesn't mean like strict like faith, like Catholicism, Islam, Buddhism, whatever. It can be anything, belief in anything. So yeah.
Totally, right.
And then one of the other kind of populations that we don't talk about a lot in Muslims and Islam is like people with substance disorders, right? What's been your experience with that, or have you had much experience with that?
Yeah, there is so much. That's such a taboo topic, I think. One of the ones in the mental health field, and being a Muslim, that is one of the least commonly talked about topics. There is just this blanket, oh, we shouldn't do that, Muslims don't do that, and so it doesn't happen. I've had people say that to me. I'm like, what? Be surprised, and it doesn't allow space for anything healthy. So the person is kind of stuck in this pattern of using substances, and they keep going back to that because they don't really have alternative ways to cope. There isn't safety in the community to be able to talk about that. But even if we look at that from a faith-based perspective, it reminds me, if you, let's say you are someone who's using substances and you're trying to work on this in Ramadan or outside of Ramadan, you're trying to take steps to get closer to Allah. Something I'm reminded of is, Allah saying that He is to us His slaves as we perceive Him to be. If we come to Him by the length of a hand, He comes to us by the length of an arm. And if we walk towards Him, He comes to us running. So each step that you take to get closer to Allah, He will meet you at that place and even more, right? And there's no space for that in the community, but Allah does create space for that, right? There's so much mercy in our faith, but I think we miss that as community members, as Muslims, we miss that. And we talk about, oh, this is what's going to happen to you. People who use substances, this is the punishment for it. And we focus on the punishment rather than the merciful way to get to that same goal. It's like what we talked about before, the absolutism versus having a healthy perspective in how we see the faith and how we see Allah, really.
Yeah, I think it's one of those things a lot of people in the community kind of understand is that, like, Islam as a whole, like, we're not supposed to be drinking alcohol, and we're not supposed to be using drugs. And, even when I went into the field of like, I'm going to focus on, a lot of my work is on substance use, there was like, even people were like, why are you doing this? Like, these people aren't worth your help. Like, unfortunately we're hearing these things, and it's like, no, of course they're still worth our help. And then they're like, well, I'm sure see any Muslim people who come to you. And I was like, of course I do. I was like, you better believe that I see
Yes.
Muslims who have problems with drinking, and Muslims who have problem with using cannabis and or other substances. Like, it happens. And I think when I work with those patients, and I come from a point of like, I almost like don't even bring religion into it, right? Like we don't even, we come from a non-judgmental point of view. You see that breath of relief, right? That sigh of relief that comes from there, like, oh, good, I can like say this, I can like share this with you, and you're not gonna like give me the, well, you're going to hell now, you understand this? Because no, of course not. Like, why would anybody kind of say that? Or if they get it from, if they might go to family members, religious places, they might get that harsher kind of approach where, again, why would they seek help from somebody who's going to tell them, well, you're just going to hell, so why even try?
Right. totally. You're right about that. And I've seen that with my clients. They might come and tell me, my parents said this to me, or on the opposite, my parents tell me I can use because they don't know how to help me, right? And I get so upset. Or they might not say it in these specific words, but I've seen this happen in families because there isn't a healthy conversation about how to address this in our faith or in the community. People don't know what to do. Parents will say, okay, well, I'd rather you just smoke marijuana because I don't want to hear your anger. It's too much for me to handle, right? It's better for me to just give you weed than for me to cope with this. So yeah, I've seen both sides of that.
Yeah, it's a tricky one, but it's something that I think hopefully again that we're moving towards understanding and acceptance that, like, again, this is part of the culture as much as we don't want to talk about it. So wrapping up a bit, I know we want to be respectful of everybody's time. We have to get ready for iftar in a few hours and all that stuff.
It's a ways away from me, but I think you're in a different time zone.
It's all good. But I always ask everybody, like, as a wrap up, like, what is your kind of self-care? How do you take care of yourself?
Oh, such a great question. I am a very strong proponent of self-care. Just because as a therapist, I think in my education was very much drilled. You got to take care of yourself, fill your cup. It's hard to pour from an empty cup, and it really is. And I value being a good therapist, and I value being supportive of my clients, and I value also being there for my family. So it's very important for me to maintain the basics, like what we talked about, having enough rest, feeding my body right, trying to get exercise, although that one I'm not that great at anymore. Try to be, but
we try.
Exactly. But spending time with family or friends, when I feel depleted, let's say I can't make it out for like a 3-4 hour hangout, maybe I can be there for an hour, so I try to do that. I love to travel. That's something, again, maybe not as manageable, or feasible all the time to do because life is life. But, being out in nature, if I can't travel, being out in nature, that's something that really fills my own cup. So I definitely try to practice these things so I can be present in my life. I notice the difference it makes for myself, and especially after becoming a mom, it's been even more important for me to practice doing these things for myself.
Awesome. Yeah, and I think it's an important thing where it's like we all have our own self-cares, right? We have to take care of ourselves, especially, the people who are like yourself, myself, people who are the healers. We're supposed to be the healers, right? We try to be the healers when we're doing some stuff, but we have to take care of ourselves. So, well, how can people who are interested in following you, learning more about you and kind of what you're putting out there, how can people come along your journey with you?
People can find me on social media. I'm on Instagram, TikTok. My handle is Mental Health with Maliha. So I talk about different topics related to mental health, and I try to gear them towards the South Asian and Muslim communities. So yeah, if people want to check that out, that's there.
All right. Well, thank you so much. I know this was like a topic that I think we both wanted to kind of talk about and have a discussion about it. So hopefully we got everything that we wanted out of this. So, and hopefully people will pick up something or other. So thank you again so much.
I appreciate it.